Ever since I was a child, I always was interested in being some sort of doctor, and always had a difficult time with dealing with death. And as a child, we had all of our dental treatment done at the dental school because we didn't have much money. So it was much cheaper. And one year when I actually needed some actual treatment done besides cleanings, my student doctor, she took me around, showed me everything she was doing, what was involved with it. Now I think I was about 14 or 15 at the time. And I realized that I could be this type of a doctor. You don't really have to deal with people dying. And it was very interesting. So I started pursuing studies to get to becoming a dentist. And once I got into dental school, and then I realized it was the actual surgery and basic sciences that was where my passion really was. So I started exploring the avenue of surgery as a career. And I talked to various people, found out what needed to be done as far as education to get to the path of oral surgery, and pursued it that way. Well, I want them to understand that I'm interested in taking care of them as a whole, not just a dental patient. So I need to understand what it is they're looking for, what their take is on dentistry, and how this treatment is going to affect their lives. Not just the aesthetics of it, not just whether or not they're fearful of dental treatment. All these things play a role in it. So you have to take that all into consideration when you're considering how you're going to treat a patient, as well as their overall physical health. If there are any type of medical problems that you have to sort out and deal with, and figure how that's going to come into play with their surgical treatment. Cone beam CT scanners are very beneficial in visualizing three-dimensionally the anatomy of a patient and allowing you to avoid certain critical structures when doing surgery, to plan out your surgery in order to place implants in a more ideal situation, more ideal position, to avoid certain vital structures. So it's very, technology has made surgical treatment predictable. The outcomes are predictable, and their treatment times have shortened because of the technology. So with 3D CT scanning, you can it's almost like you're inside the patient looking around and planning out your surgery.